Good morning, everybody. Thank you for waiting. We wanted to make sure we had our press people here. This is a press conference to really talk about some partnerships in the city of Orange Township. And I'm very happy that we have some major partners who you'll be seeing and hearing from shortly. But first, just by way of history, for those that don't know or may already be aware, we did in fact have a hospital closure many years ago. It was the Orange Memorial Hospital. Many of you were born there. Many of you were treated there, but nonetheless, it is now closed. That created a vacuum within our city when it came to health care and our ability to service the needs of our community. We have a lot of smaller providers in town that we've been trying to work with and partner with. And what we did was we created the OA program, the Orange Health and Wellness Alliance. And through that, we've been able to partner with private community organizations, private corporations, because we realize that government in tough economic times does not have the financial wherewithal to shoulder the burden for all of our economic woes. So through these partnerships, we've been able to make big strides. We've also, first let me thank our partners. We have East Orange General Hospital here. They are our community branch in East Orange. Let's give them a round of applause. They're always doing major health screenings, so we appreciate them. E&M Pharmacy, one of our local pharmacies, so we appreciate you as well. And then I think even speaking to the fact that this is one of the worst economies since the Great Depression, where people are losing their homes, where they're losing their jobs, when people are really impacted at home on their daily, day-to-day needs, programs that really help you as it relates to your health care and your ability to get medications become even more important. The City of Orange Township has partnered with the Hines Family Foundation to create a new patient assistance program to uninsured residents in the City of Orange. The RX Patient Assistance Program connects residents with a year of free brand name prescription medications to qualify. Patients must not have prescription coverage, and they must also meet income guidelines, which are typically around $21,000 for an individual or $44,000 for a family of four. And individuals without legal residency status may also be available. So what we're really trying to do here is, again, touch people in their homes and help them stay healthy, because everybody in our community matters, and we realize that when you're losing your jobs, you have a diminished ability to provide health care for yourselves and your families. So we have to take it to the next step. We have to take it to the next level and not just leave our residents to fend for themselves or rely totally on the federal government or the county government or even the state, and reach out to our community and partners in corporate America. So without further ado, I want to bring up somebody who has traveled a long way, a friend, a partner, somebody that cares about the state of New Jersey, cares about people, Jeffery Lewis, the president of the Hines Family Philanthropies. Come forward, please.
Good morning. Thank you. Thank you for being here, and thank you for the opportunity to help provide some solutions to people who live here in Orange. Today we're announcing two very specific programs, as the mayor referred to. The first program is for people who have one or more chronic diseases. What we call Orange RX. Any individual who takes congestive heart failure medications, diabetic medications, any kind of medication that you take every day over a long period of time. If you're not on Medicare and you're not on Medicaid, you can sign up for Orange RX, and if you income qualify for it, the medications are free. Great program. We're trying to find every citizen who lives here who would be income eligible and enroll them in the program. Second program that we're doing today, which I think is just as exciting, is a partnership with E&M Pharmacy. E&M Pharmacy is a local pharmacy, and we're proud to work with them because they're real leaders. We launched today for the next 3 months as a pilot project a $2 generic drug program. Through E&M Pharmacy, we have created a very long list of generic medications. You take your prescription into E&M Pharmacy. You see Rakesh Modaldi back here, who's with us today. He's right here. And you present your generic medication, and if it's on our list, it only costs you $2. It only costs you $2 this month, and next month, and the month after, and etc. The whole idea is that E&M Pharmacy has agreed to work with Hines and our nonprofit PS2 to really help people during the holidays who take one or more generic medications and who can't afford the large costs. This is a great way of helping people have more money in their pocket. So we are delighted to bring that kind of a solution to Orange, delighted to partner with our dear friend the mayor here, who has really just done a phenomenal job, and it's an honor and a privilege to work with the mayor. The other partner that the Heinz Foundation works with around the United States is the pharmaceutical industry. Pharma, which is the trade association that represents all pharmaceutical manufacturers, has worked with the Heinz Foundation and PS2 for a number of years. Together we go and meet with mayors and county officials and governors and state legislators, helping think through how to create solutions and help bring pharmacy costs where people are having problems. My friend Ed Belkin is here today from Pharma, who will say a few words, but I would like to just remind you that in New Jersey, pharmaceutical manufacturers are one of the largest employers in the state, both as direct jobs and indirect jobs. We're very proud to partner with them. We do it elsewhere, as I said, around the country, and we hope to do it for a very long time. So let me introduce you, my friend Ed Belkin.
Jeff, thank you very much for those kind words. On behalf of the Pharmaceutical Research and Manufacturers of America, it's a privilege to be with you here today. I want to acknowledge Mayor Eldridge Hawkins Jr. and the Orange Health and Wellness Alliance for their efforts to launch this important prescription discount program for Orange residents. I want to thank the Heinz Family Philanthropies, Jeff Lewis. As Jeff mentioned, our partnership, the Heinz Family Philanthropies, are great partners to work with. And at Pharma, we've been fortunate to work with Heinz on a number of initiatives, including the nearby Newark RX, and Heinz's commitment and enthusiasm on issues such as improving the health of the uninsured and building stronger communities is always inspiring. You know, there's nothing more important than the health of our communities, and we're here today because of that commitment and a terrific effort by Mayor Hawkins and the Orange Health and Wellness Alliance to make those words tangible with deeds that will help the uninsured and seniors with needed health education and preventative health care services. Prevention, keeping everyone healthy and active and helping them lead longer, healthier lives is particularly important. America's pharmaceutical research and biotechnology companies understand this challenge, and that's why we created the National Partnership for Prescription Assistance, PPA, to help uninsured and financially struggling patients get access to medicines that they need to stay healthy or get healthy. PPA is made up of more than 475 patient assistance programs nationwide, including 200 directly supported by biopharmaceutical research companies, many here in New Jersey, helping uninsured patients qualify to get their medicines for free or nearly free. I should mention that since we started PPA almost 6 years ago, we've helped more than 6.5 million uninsured Americans, some 213,000 right here in New Jersey, get access to patient assistance programs. But Pharma's member companies' commitment to helping patients in need extends beyond helping those who can't afford their health care coverage. Our companies research and develop new medicines to fight diseases, from cancer to diabetes, heart disease, and a host of rare and deadly conditions. And because today is dedicated to efforts to improve the health of Orange residents, I think we should take a minute to reflect on one of the biggest challenges we face in America when it comes to the health of our seniors, Alzheimer's disease. If you're unaware, November is National Alzheimer's Awareness Month. Alzheimer's is a disease that strips its victims of their memory and slowly steals their health and eventually their lives. And it isn't just the Alzheimer's patients who suffer, because for every patient, there are family members and caregivers who struggle with the physical, emotional, and economic toll of providing care. But the Alzheimer's crisis that we face in this country doesn't just fall on patients, their families, and caregivers. Alzheimer's is taking a huge toll on the national economy, and it looks to take an even bigger toll as the number of those suffering from Alzheimer's disease increase. Today, according to the Alzheimer's Association, 5 million Americans suffer with the disease. And it's estimated if no new treatments are found, by the year 2050, that number will jump to an estimated 13.5 million Americans, with treatment costs topping $1 trillion a year. That's more than the current U.S. defense budget. In short, Alzheimer's is a healthcare tsunami headed in our direction, threatening the lives, well-being, and pocketbook of every American family. We can't wait to help those patients or future patients threatened by this scourge. And that's why America's biopharmaceutical research companies today are working on nearly 100 new medicines to treat and even cure Alzheimer's disease. In fact, many of those medicines are in late stages of development or testing or being reviewed by the Food and Drug Administration for approval for patient use. And we've detailed that in a new report we released just this week, and I've provided copies out in the lobby. But we have a long way to go, and the work on new treatments and even a potential cure, the men and women who work for America's biopharmaceutical research companies, many of whom are your neighbors, family, and friends right here in New Jersey, are working hard to deliver both hope and new solutions to this most difficult health challenge. Again, it's a pleasure to be with you today. Mr. Mayor, thank you for everything you are doing to help improve the health of this community, and congratulations to the Orange Health and Wellness Alliance for your great work. Thank you all.
Thank you. I also want to just take a minute to thank and recognize all of our seniors for being present. I see many tenant association presidents, or past or former tenant association presidents, and I think the success, social workers, everybody that's involved with the process, the success of this particular program in part will be because of you and taking this information back to your buildings and sharing it with your residents so that they can access this program. I also want to take a minute to thank Darryl Holcomb, my Director of Community Affairs, and his entire staff in the health department and nurses for helping to lay this program out. At this time, I want to bring up one of our other community partners, Krista Zuccheri, if I didn't say that wrong. Did I get a thumbs up on that one? Yes. All right. She's our Associate Director for Family Connections. Let's give her a round of applause.